Good afternoon. I'd like to call the Human Service Committee meeting to order for January 15th, our first one of the new year. Please rise and join me in the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Can we have roll call, please?
Mrs. Burdick.
Here.
Mrs. Ricketts Wales.
Here.
Mr. Barnes.
Present.
Mrs. Hanchett.
Here.
Mr. Healy.
Here.
Mrs. Root. And Mr. Harris. 5 present, 1 absent.
Thank you. And I will entertain a motion to approve the minutes of December 18th, please.
Hanchett will move. Ricketts Wales will second.
Any corrections or additions? All in favor?
Aye.
Carried, thank you. If anybody has the agenda in front of you, you'll see we have a lot to cover today. It's that time of year where we're approving a lot of contracts, so please bear with us. We will try to group a bunch of them together, but we will have to go over each one individually. So we will start with Anita Masson, Director of the Office for Aging. Welcome, Anita.
Hello, thank you. The first thing on the agenda is our monthly report. I just have one thing to highlight for the monthly report is our insurance counseling. We've been giving an update every month on that. If you want to look at last year at this time, this is the November units, so this is a full month of our open enrollment time frame. We had 433 hours of insurance counseling last year. This year we had 994 hours of insurance counseling with the same number of staff doing insurance counseling. So more than doubled what we were doing for hours. That's the only highlight I have for the monthly report.
That's a big one. Yes, good job.
Thank you.
All right, so I guess we can move right on. We'll start with the go and die-in agreements, and we are going to go over each one, and then we will vote on all of them in one motion.
Okay. So the first one that we have for the Go and Dine is for the Aces Country Cupboard. We're looking for a resolution to enter into an agreement from January 1st to December 31st. This is for a food service establishment for Go and Dine. The rate would be $13 per voucher that is redeemed for breakfast, lunch, or dinner for any Go and Dine participant. We do have this budgeted in our 2025 budget.
You can just keep going.
Keep going?
Yep, and then-
Okay.
Yep.
The next one is also for Go and Dine. This is for Donnie Jeans in Belmont as our food service establishment. The rate is $13 per voucher redeemed, and that is also in our 2025 budget. The next one that we have is for Copper Keg, which is in Cuba. The rate is $13 per voucher redeemed for our Go and Dine participants. That is in our 2025 budget. And the last one for Go and Dine is TC's Diner in Friendship. Again, $13 per voucher redeemed for our Go and Dine, and it is in our 2025 budget.
All right, thank you. Can I have a motion to approve those 4 go and dine agreements?
Ricketts Wales.
Healy will second.
Any questions? I see, are you trying to standardize the amount?
We are trying to. It makes it a lot easier. The cost of meals can vary depending on what is on their menu and what is approved by a registered dietitian in order to meet our state regulations. This makes it a little bit easier to conform all of our menus into one rate.
Great, yeah.
So,
Okay. All right, any other questions? All in favor? Aye. Carried. All right, and then the next 2 we will do separately. We will do each one individually, I guess.
okay. So the first one that we have is for consumer-directed contracts. This is for our home care, for ISEP, our 3E, which is our caregivers, our unmet needs funds, and our ADCSI, which is our Alzheimer's Caregivers Support Initiative grants. This is for AIM Independent Living Center, which is a fiscal intermediary for our consumer-directed program. We are looking to enter into an agreement with them at the rate of $28 per hour. That is an increase of $1.07 from last year's rate. That should be 2024's rate.
Okay.
Sorry.
Can we have a motion to accept that?
Hanchett will move.
Second, anybody?
Helio, second.
Thank you. Any questions?
Thank you.
All in favor?
Aye.
Okay.
abstain.
Okay, thank you. All right, and then we will go to the Trusted Choice Home Care.
This is, again, for consumer-directed services, same funding streams, which is our ISEP, our 3E, which is Caregivers Unmet Needs, and our ADCSI, Alzheimer's Caregiver Support Program. Trusted Choice Home Care is another fiscal intermediary. We're looking to enter into an agreement for $27.50 per hour for aid service. That's a $1 increase from last year.
All right, can we have a motion for that one?
Ricketts Swales?
Second, anyone?
Hanchett will second.
Any questions? All in favor?
Aye.
Carried. And then we have 2 home care service contracts.
So we are looking to enter into an agreement with Home and Health Services for home care services under ISEP, ADCSI, Unmet Needs, and 3E or Caregiver Funds. The rate would be $30.50 per hour, and a nursing supervisory of $130 per visit. This is a $1.50 increase per hour for home care and a $5 per visit increase for the nursing supervisory. Those are required by New York State regulations that we have those, and this is included in our 2025 budget.
Can we have a motion to approve that one?
Hanchett will move. Ricketts Swales will second.
Any questions? All in favor?
Aye.
And Jan and Bev's.
Thank you. We are looking for permission to enter into an agreement with Jan and Bev's of Wellsville underneath the ISEP, 3E, ADCSI, and Unmet Needs Funds. We're looking for a rate of $32 per hour. That is a $1.25 increase from the 2024 rate. And this is included in our 2025 budget.
Can we have a motion to accept this one?
Ricketts Swales will move that. Hanchett will second.
Any questions? All in favor?
Aye.
Carried. All right, and now the next group we will do together, but you'll go through each one, and then we will do one vote on all of them.
Okay. So the first one is a request to enter into a lease agreement with Alfred Union University Church for Alfred Congregate Luncheon Site. This would be for $17.50 per day that we use the facility. That is no change from 2024's rate. The next one we're looking to enter into is Herbert D. Elong American Legion. That is in Belmont, and there's no charge for that location. That's our Belmont location. The next one is the Bolivar Fire Department. We're looking to enter into an agreement with for the Bolivar Congregate Luncheon Center at a rate of $16 per day, and that is no change from 2024's rate. Our next one that we're looking to enter into get permission to enter into is Canasarega Fire Company. That is no charge for our Canasarega luncheon site, and that is no different than last year. Our next one that we're looking to enter into an agreement with is Cuba Fire Department for our Cuba luncheon site. That is $16 per day, and that is every day that we use it, and that is no increase from 2024. The next one is William P. Brooks Hose Company in Fillmore. So this is for our Fillmore Congregate Luncheon Site at a rate of $11 per day, and that is no change from 2024. Our next one is the Town of Friendship for our Friendship Congregate Luncheon Center, and there is no charge for that site, which is no different from 2024. Our next one is Grace United Church in Wellsville for our Wellsville Congregate Luncheon Center. That is $12 per day for 2025, and that is a $1 increase per day from the 2024 rate. The next one that we're looking at is Board of Fire Commissions of Independence. So this is for our Whitesville Congregate Luncheon Center. That is a rate of $12 per day, and there is no change from the 2024 rate.
All right, can we have a motion to approve all of those Congregate Luncheon Center lease agreements?
Ricketts Swales will move that.
Helio, second.
Any questions or comments? I just would like to say that we appreciate all these locations providing these spaces, even especially the ones that we don't have to pay anything for, but even the ones we pay for, we wouldn't know where to go if we didn't have them, so.
Absolutely.
Yeah, so, okay, all in favor?
Aye.
Carried.
Thank you.
All right, then we have a few more things to look at. Oh, did we vote?
Yeah.
Yeah, I think so.
I didn't hear you, I guess. Aye.
Thank you, Gary. All right, so the next one is the Center for Elder Law and Justice.
Yep. So we are looking to enter into a contract with the Center for Elder Law and Justice, provide legal services for our residents who are 60 years of age and older. This is at a rate of $75 per hour, and this actually is the same from 2024 and has been accounted in our 2025 budget.
Can we have a motion to accept that?
Hanchel will move. Ricketts Swales will second.
Any questions? All in favor?
Aye.
Carried. Okay, request for proposals for the PERS.
So we are looking for permission to conduct an RFP, which is a request for proposals for our Personal Emergency Response System, or PERS. Our current contract is up shortly, and we would like to be able to send out an RFP to get rates from other vendors and make sure that we are meeting our needs most effectively. We do have this budgeted in our 2025 budget at our current rate with a little bit of flexibility based on the RFP.
Have a motion to approve this.
Ricketts Swales will move that.
Healy will second.
Any questions? Are there many companies out there that will submit a bid?
We do have quite a few companies that submit bids. A lot of them, there aren't any local companies, unfortunately. The most local that we've ever had was St. James, but they went out of business a while ago. Doyle is the next one, they're out of Rochester. So we do usually have about 5 to 6 vendors who submit, and I have had 2 additional vendors who are new in the area reach out, so I'm not sure how many we'll get this year.
Good. Okay.
Is this, I'm
sorry,
sorry.
go ahead.
One other question is just, is it a wearable device?
Yep, so the PERS, the Personal Emergency Response button, is a button that you would wear around your neck, or you can have it on your wrist. We also offer a watch option right now underneath our current contractor, and we do offer a GPS, so you don't have to be at home to be able to get emergency services.
Thank you.
You're welcome.
Okay, any other questions? All in favor?
Aye.
Carried. And finally, elder abuse.
So the Office for the Aging is requesting permission to apply for the Elder Abuse Education and Outreach Program Community Mini Grant from Lifespan of Greater Rochester on behalf of the Allegheny County Elder Abuse Prevention Committee. So activities that we do with these funds would include education and outreach to increase awareness and recognition and reporting of abuse, neglect, financial exploitation of older adults in our community. The revenue and expenses will be added to the 2025 budget if we receive the grant. So we're looking for permission to apply on behalf of the Elder Abuse Prevention Committee, which we had.
And we have a motion for this one.
Healy will move it.
Hanchel will second.
All right, any comments or questions? How much are you applying for?
We're looking to apply for $6,000. It's a maximum of $8,000 grant.
Great. All right, all in favor?
Aye.
Aye.
Carried. Thank you, Anita.
Thank you.
All right, next is Tyler Shaw, Public Health Director. Welcome, Tyler. You don't have a bunch of contracts for us this month,
I do
you?
not. Good afternoon. Monthly report updates. We're closing out 2024, so you won't see those numbers likely until next month when we have those finalized numbers, but just a quick update on those. Did crunch some numbers for our communicable disease investigation. So in 2023, we ended with 274 investigations total. We are now at about 428, which is a 56% increase in communicable diseases. Some of that is attributed to updates to the state's reporting system. So probably about 20% of that is RSV is now reportable, and varicella chickenpox is now reportable as well. We don't see a lot of those cases, but some of that mainly is the RSV stuff coming through our system. I'd be remiss to say if I didn't mention, we still have flu vaccines available. So primarily right now, flu A is prevalent. We see that switch over in peak season for flu B in February, March, sometimes even into April. So there's still time to get your flu vaccine. So far, statewide, not just Allegheny County, there have been 2 pediatric flu deaths so far. Flu still is considered geographically widespread. And then I will also be remiss if I didn't talk about bird flu. That's been in the news, in the national news especially. 66 total cases, human cases across the nation, so right now. So that's California, Colorado, Iowa, Louisiana, Michigan, Missouri, Oregon, Texas, Washington, and Wisconsin. I'll have this for the meeting minutes too for you, Tiffany. But those are human cases. There have been millions of cases of actual birds that have been tested that have come back with bird flu as well. So certainly, the flu vaccine for humans is not going to prevent you from getting bird flu, but it might prevent you from having more severe symptoms. There was 1 human death in Louisiana. I'm not sure if you heard about that. We don't have much details on that. It's been pretty, obviously there's HIPAA protected information, so we don't get a lot of that data, but there has been 1 human death. So low risk in Allegheny County still. If you are interacting with dairy cattle, especially poultry, and you have issues, our main message for the public is if you have any concerns about sick animals, certainly can call our office. We can connect you with the authorities that can do animal testing. We're primarily here for the human portion. So if you need certain testing for humans, that's kind of where our office steps in.
Great, thank you, Tyler. Any other questions for Tyler on the monthly report? All right, I guess we can move on to the Thornton Engineering Agreement.
Yep, so we're looking for a resolution to approve the contract with Thornton Engineering. There's been no increase from last year's contract for this year, and that has been budgeted.
We have a motion to accept this.
Hanchett will move.
Second,
Cricket Swales will second.
any questions or comments? All in favor?
Aye.
Aye. And that's carried. Anything else today?
That's all.
Thank you, Tyler.
Thank you.
All right, Mr. Horn of the Commissioner of Social Services, welcome, Don.
Thank you. Good afternoon.
And I believe Don does have several things for us today.
And start of the year.
Yes.
Get everybody in line.
So we'll start with the monthly report and then move on to the Child Advocacy Center contracts.
Monthly report is pretty consistent on our accounts. It's been very cold, so we've been placing a lot of code blue people. As of late, we expect that to continue as long as the temperature remains below 32. So we'll see a jump on next month's report on that.
Do you have enough places to place people?
Right now, we do. We monitor that pretty closely. Last week, we did call around to see what was available when the cold snap started to make sure that we were going to be able to cover the calls that we got. So far, we're doing pretty well. So.
Good. Okay, great. All right, so if there's any questions on the monthly report? If not, we will move on to the contracts. We will start with the Child Advocacy Center, and we will group those all together.
Okay.
And then we will vote on them. So there's 6 of them, I believe. So yes, if you want to go through each one.
Okay. All the child advocacy centers are all budgeted in 2025. The first one is for Cattaraugus County Rehabilitation Center. That's for maintenance and cleaning of the Olean office. The next one is for Dr. Coyne. Dr. Coyne is the medical director. He oversees all of the medical for the Child Advocacy Center. That contract is for $30,000 for the year. The next two, Brandis Gaylor and Cheryl Wire, they are our sexual abuse nurse examiners. They charge $300 per exam that they do. They are reimbursed through the Child Advocacy Center through a program called FRE. And then the next one is the Olean General Hospital. That is for laboratories, blood work, or any kind of test that we run, and they bill the county back for that. They do bill at the Medicaid rate. So there's whatever service they do is the rate that they're going to charge. And then the last one is for Dr. Zuckerman. That's also an annual contract of $12,000. And he will oversee some of the medicals or evaluations that we do at the Child Advocacy Center, or he himself can do some of the evaluations of the children and families that we get.
He's the Psychologist, right?
Yes.
Not, okay,
Yes.
not a medical doctor. Thank you.
Yep.
Okay, can we have a motion to accept all of these?
Cricket Swales will move that.
Second?
Helios, second.
Any questions or comments? Does Cat County pay us anything toward the Child Advocacy Center? Is that strictly our cost?
That's our cost, and that's reimbursed through OCFS, Office of Victim Services, and then, of course, we do the National Children's Alliance that we just were accredited for again. And then Arden does get some other grants, so we can pretty much cover all the costs for the Child Advocacy Center.
Okay, thank you. Any questions? All in
If
fa-
we
Oh, sorry,
accept-
Mr. Healy?
We accept donations too. Is that
Yes,
correct?
we do.
Yeah,
Yes,
thank
we do.
Any other questions? All in favor?
Aye.
Carried. All right, then we will move on to the social service contracts. And again, we will go through those 5 and then approve all of them after you go through them all.
Okay. The first one is for Laboratory Corporation of American Holdings. We use this contract for DNA testing for child support matters to prove paternity. They charge, where did that go? $170 per test that they do, and we have a maximum that will pay them of $18,000. The next one is,
Just, Don, the MOE says 47 per test.
I'm sorry, I was reading the wrong paper.
Okay,
Mine are out of order, just kidding.
no
I'm
problem.
sorry.
Just want to make sure we're,
Yep,
you know, doing the right one.
okay, I got ahead. It's pretty, both sides. Yes, that's $47 an hour, that's reimbursed at 66% through federal funds. The next one is going to be for Southern Tier Traveling Teacher. That is for them to help people get their equivalency diplomas. They actually will go out to the house for those that can't come in for schooling to help them get better jobs and get them on the road to success. That's budgeted $142,160. The next one, we have to have a legal service that we can refer people to. That's mandated by the state, and we do use Legal Assistance of Western New York. We do use that for people who apply for SSI that may need help for that, or if they might run into problems with, say, a landlord, which is few and far between, we can refer them over there for that too. That's a maximum of $10,000 a year. The next one is Dr. Anderson. He is also a psychologist. He charges this is the one I just read, $170 per hour, a maximum of $18,000 a year. He mostly works with our child welfare families and the children and the parents if we need assessments, and then we can use those assessments if we have to go to court or if we want to recommend a program that the family needs to go into. We can use that assessment for that. And then the last one is we are mandated to have a drug and alcohol counselor, and we contract through Allegheny County Council on Alcohol and Substance Abuse. And that is a maximum of $69,500 a year. And that person actually sits here at DSS, and if somebody comes in and they screen for help or something with substance abuse when they're applying for services, we will have this person go out and talk with them, and they can make recommendations for treatment.
Can I have a motion to approve those?
Hanchett will move.
Second?
Cricket Swales will second.
Any questions? We're covering a lot of information today, so,
Yes.
so if anybody does have any questions about any of these, please get hold of Don, and I'm sure
Yeah.
he'll be glad to sit down with you and explain any
Absolutely.
concerns or answer any questions.
Yeah,
All right,
absolutely.
all in favor of these?
Aye.
Carried. And now the domestic violence services, and we can do both of those together.
Yep. These are both with Accord, and they are also budgeted in 2025. The first one is for our non-residential domestic violence program, and this is where Accord will do outreach, run a hotline, make recommendations for treatment or placement. And then the next one is Women's Chances, and that is actual sit-down class, like a round table for people who are victims of domestic violence so they can work through their issues and get back on the road to success.
All right, can we have a motion to accept these two?
Helio makes the motion.
Second,
Hanchett will second.
any questions? All in favor?
Aye.
Carried. All right, now we will move on to the preventive services, and again, I believe we can bundle these and vote as one.
Okay. The first one is Together for Youth. Last year, they were known as Berkshire. This is for our after-school program that we have at two schools in Allegheny County. One is with Genesee Valley, the other one is with Bolivar Richburg. And this is a mentoring program for children that are identified that could possibly be persons in needs of supervision. The next one is Catholic Charities of Rochester. That is for our SHAPE program. And that one is budgeted at $292,861, and that is for supervised visits or coach visitations and parenting classes. The next one is Hillside Children's in-home parenting, and that one is budgeted at $123,600, and that is for parenting and coaching visits in the home. The next one is for parent education, and that's our Families First, which is budgeted for $94,160, and that is for also parenting and education and doing home visits in the home to make sure that they're following through. The next one for parent education is Families Together. That's budgeted $156,039. That is similar to Families First, but that's more of an intensive program, and they will make several visits per week, and this is for more of our problem cases to get people to follow through to make sure we can reunite the family. So after that is the READY programs. The first one is community-based treatment. That is budgeted at $277,500. This is for coach visitation, mentoring for children, and parenting and intervention if there's like maybe a problem within the family household, and maybe they can mediate between the children and the parents. And then the last one is also a READY contract, which is our foster care transitions, and that's more of a moderating when the children go back home from foster care to identify problems and help people work through that so they can stay in an intact household. And that is budgeted $115,000 a year.
Okay, can we have a motion to approve these?
Ricketts Swales will move that.
Second,
Hanchett will second.
any questions? Yes, Mr. Healy.
Thank you. Don, most of these contracts are for services, if not all of them, are for these services that are mandated by the state, and they're the most cost-effective way to deliver these services that we found out over the years. Is that not correct?
That is absolutely correct. We find that if we don't offer these services, we will get a lot of children that will end up in care, and paying for preventive services is a lot cheaper than paying for a child who could go to an institution or go into foster care. And it's much better to keep the family intact, and it gives them a better chance to make it through the issues that they're going through at the time they were referred to us.
More cost-effective than us trying to do all that ourselves.
Absolutely. And-
Thank you.
Yep.
Any other questions? All in favor?
Aye.
Carried. And I believe we can bundle the next four also, and then make a motion at the end. So you can go ahead, Don, with
Okay.
the new services.
All four services are the same for Allegheny County Community Services, Together for Youth, and Catholic Charities of Rochester, and Hillside Children's. This is for a qualified individual. What can happen is when we get a child that comes into care, however they arrive at our doorstep, if they're placed in a qualified residential treatment program, the state, under the Families First Prevention Services Act, has a certain timeline that we have to adhere to, where they have to review our decision or the court's decision to make the placement into a facility. And a qualified individual has 30 days to do the first initial assessment, and then there's a 60-day mark where we have to be back into court, where they agree or disagree. And if we do not make these timelines for these assessments, we could lose the potential of a child who could be 4E, which would be a 50% federal reimbursement with a 50% state reimbursement, only being state reimbursement and local reimbursement. So we like to have at least 4 providers because we just don't know who's going to be available in that time frame to be able to perform that assessment.
Okay, great.
And the majority of those are paid for by Medicaid because it's a Medicaid service.
All right, can we have a motion to approve those 4?
Gilliam will move it.
And a second?
Wicked Swales will second.
Any questions? All in favor?
Aye.
And that's carried. And then you also have home care services.
Yes, the first one is for Jan and Bev's Home Care. This is a lot of home nursing, if they need help in the home with like maybe daily chores or other things that they may need have done in the home. And that's also billed to Medicaid directly. And Will Care is a very similar service with nursing services and helping with household chores. And that is also billed through Medicaid at a Medicaid rate.
All right, can we have a motion to approve those 2?
Hanchett will move.
Second?
Wicked Swales will second.
Any questions on those? All in favor?
Aye.
And carried.
Okay.
All right, now I believe we'll probably have to do each of these individually.
Okay.
Since their budget.
Okay. The first one, we were notified by Office of Children and Family Services at the state level for their support to continue the child advocacy centers. They issued and asked us if we wanted to apply for the $66,600, which of course we would. And we put together a plan and it was accepted. And we will use this money to cover a little bit of travel, some maintenance contracts. That's going to be for our Celebrate program that we use with law enforcement to extract things that could be deleted on electronic devices because they have a subscription basis each year. And then the rest of the money we're going to use to cover salary and fringe benefits for 2 employees at the Child Advocacy Center.
All right, can we have a motion to accept that?
Hanchett will move.
Second?
Wicked Swales will second.
Any questions or comments? All in favor?
Aye.
Carried, thank you. And then the youth,
Yep. This is the first step for the Youth Bureau to start, so we can request for people to apply for monies for the youth sports programs or the youth developmental programs. And we need permission for the board chairman and the treasurer to be able to sign the resource allocation plan, also known as the RAP. And then after that is done, we'll issue RFPs and people can apply, and then I will come back and ask to appropriate those RFPs, and then we'll claim those and get the reimbursement for them.
Very nice. Hanchett will move.
can we have a second?
Wicked Swales will second.
Any questions?
Question,
Yes.
are we just a pass-through for those funds?
Yes, yes, we can pass
So
through.
so they go out to local communities?
Yes, they do.
All right, thank you.
Do you know about how many communities took advantage of that last year?
I'm picturing, because we just went through the billing yesterday, there's 5, 6. It was either 13 or 14 organizations applied for the sports allocations, the 2, and then we had our normal people for our youth developmental that we put out every year, that we've done.
And they have to apply, right?
They're going to have to apply this year. After we put out the RFP last year, the way we did the sports program, the state really liked that, how we did that. So we're drafting a new RFP for the youth developmental programs now.
Great.
So,
Great.
and we'll put that out, and we'll do it the same type of advertising that we did for the youth sports.
Very good, yeah. Okay, any other questions? All in favor?
Aye.
And that's carried. And we have one more.
Yes. Last week, we were just notified that the next round of Office of Victim Services money can be applied for. We need permission to be able to apply for that. That is a 3-year grant that's mainly funds the Child Advocacy Center. And there could be up to a 0 to 25% match for that money when we apply. Over the last year since we took it over, that match was waived, and we can apply to waive that again. Round numbers to run the Child Advocacy Center on like a bare minimum runs about $700,000 a year to $750,000 a year. So the match could be based on that. We'll definitely be applying for that much money and more to expand some of the services that we have over there. But I'm not sure how much they will approve and how much we will get. So I'll have to bring that back when that is approved.
Okay, we have a motion to accept this.
Rickett Swales.
Second,
Hanchett, second.
any questions? Yes, Mr. Healy.
Any other possibility for funding out there, either from private or public sources for additional grant?
We do have, for the Child Advocacy Center right now, we have 2 grants. One covers the mobile unit, one is for the multidisciplinary team, and we use that to cover salaries and other expenditures. And then, of course, we have our NCA grants. We had 2 this year that are up. We applied for another one that we got permission for. I wanted to bring that today, but we just got notification yesterday that we are approved for that. And then through Ardent, they had the Ralph Wilson Foundation.
Right.
They had, did some money, and I think the Allegheny County Foundation also had money that we used for that.
Well, thank you.
All right, any other questions? All in favor? Carried, thank you. Thank you, Don, for explaining each one of those so that we at least had some idea what each of those is for. It was very helpful, at least to me, so thank you.
Right. And if you have any other questions, I'm always there.
Thank you.
Thank you.
All right, next we have Dr. Anderson. Welcome, Dr. Anderson.
Thank you. Thank you for letting me sneak in.
Sure.
I appreciate that. Before I bring this up, I would like to just update you a little bit about our move and where we are. DPW started moving us yesterday, and I don't know how long it'll take them because we're still packing lots of different things, and it is not an easy task. I was discussing with Keith earlier that there are 47 file cabinets. You have to unload all of them. It takes 5 boxes to take each one of those. And then you'd have to bring them up out of our basement, take them over to 55 and take them down into their basement. So that's just for the file cabinets. And they also came today and moved our boardroom, so we will be having our community services board meetings over in 55 from now on. And Keith, I'm going to stomp on your toes because Keith is not having a good week. He's having to deal with Spectrum. And he spends most of his time apologizing to community services for Spectrum's inefficiencies. Is that a good enough word? So, and I really do appreciate both DPW and IT for all the work that they do, and mostly for the fact that they do these things without, I never have to see Spectrum. That's wonderful. That's worth Keith's salary. And I really appreciate that. And it is just so nice to have the departments work so diligently and efficiently to get things done.
Question, how much of that stuff how long do you have to retain all that stuff? Forever and ever, or is there stuff you can get rid of?
We have to keep a face sheet of people, but we don't have to keep total histories after 7 years, I think it is.
Okay, so.
But You know, we see several hundred, perhaps more a year. And I will say that we're lucky we're not DSS, where they have files they have to keep forever and ever and ever.
Okay, I thought as long as they were moving, maybe if there's some stuff you can get rid of, we'd be glad to do it.
We did that.
Okay, all right.
We have, let's see, we did, well, it cost us $750. I think there were 400 files that we were able to get rid of. And so we do that every year. We get rid of the ones, yeah. So, any other questions on that? Anyway, thank you very much.
We're just very happy to hear that the move is actually in process, and we're very excited to see you over there and the other building gone, and and certainly want to thank Keith and Tom at DPW for everything that they've done to make this happen, so.
My memorandum of explanation is to be able to pay for a contract that we have with our fiscal officer, Victoria Bryant, and the fees for 2025, we are paying her $48 an hour for the services performed under that agreement. It amounts to somewhere the increase over 24 is less than $500. And so we're not expending an awfully lot of money. And I'm sorry, I didn't bring the actual figure that I did spend in 24. Sorry.
Okay, can we have a motion to accept this?
Ricketts Swales will move that.
Helio, second.
Any questions? I'm not sure if this is correct on the agenda, but it says the agreement for her for 2024 and then agreement with her for 2025. Are we approving both of those?
Please,
Okay, so we didn't do it in 24, I assume?
correct.
Okay, okay, just want to make sure so we need one for 2024. The first one will be 2024, so can we have a motion? Okay.
Does the back table have something they want to add to this conversation or not?
So I have reviewed both the 2024 and 2025 agreement, and they both meet with my approval. So they're all set to go.
Okay, so let's approve the 2024 first, and we have a motion and a second, so all in favor of that one?
Aye.
And then can we have a motion to approve the 2025 agreement?
Hanchett will move. Ricketts Swales will second.
Any questions? All in favor?
Aye.
And that's carried. Thank you.
Thank you.
All right, do we have any unfinished business today? Any new business? Any good of the order? I will take a motion to adjourn.
Ricketts Swales will move that.
And a second?
Hanchett will second.
All right, all in favor?